rest of the team. So I'm going to spend the next few minutes just giving you some bullet points that will hopefully provoke some questions for us to address later on in this symposium. So I think there are basically four things that are important to consider, or four factors that we can consider with respect to embryo culture. The thing that most people talk about and what you hear when you're at conferences, what media do you use? Do you use media A, do you use media B? This is the really the holy grail around what our embryos are exposed to. I'm not going to be talking about media composition specifically. Clearly, there are questions around whether some media compositions promote more euploidy or higher blastocyst formation rates. But as you'll see down at the bottom of my bullets here, it's really how you use these things more than the composition of the media, in my opinion, that can optimize the performance of any particular product. Of course, as Dean mentioned, the local culture environment, the air, VOCs, the air that the embryos breathe, i.e. the gas concentrations, the atmospheric pressure that your practice is at will affect the pH. The humidity, are you culturing in dry or humid incubators? As I'm moving down to the next factor with respect to embryo culture, what are the equipment that you're using? Are these big box incubators? Are they benchtop incubators that make maybe monitoring pH and other factors more challenging? If you use a pre-mixed tri-gas, for example, will be different how you monitor and adjust factors than if you have independent gases, for example. And probably most importantly, and most important on any of the factors with respect to embryo culture, in my opinion, is the standard operating procedures that you implement in your practice. One size doesn't fit all. We're going to hear about running a small lab versus a big lab at the end of the presentations today. And what works for a 3,000 cycle IVF lab may not work for a 300 IVF cycle lab. But the most important is to adhere to good standard operating procedures. One example I want to mention is with respect to QC monitoring that Alison mentioned. How do you measure the pH in your benchtop incubator? That process alone can change your interpretation of your culture environment. So again, good QC measurements, adherence to good protocols and good policies are really going to optimize any embryo culture environment that you may have. Again, one size does not fit all, and there are many ways to skin a cat. So I'd like us to think about the overall conditions. It's not just what media you use or what's the media to oil ratio, or do you culture in groups or not. It's the overall conditions, and it's the accumulation of these conditions that ultimately are going to affect the environment that you culture in. And the big sort of acronym or term here is pH. I think pH is the best finger on the pulse for your cultures. Standardizing the pH maybe for the different culture intervals, understanding in your lab what does best. But in general, I've witnessed pHs decreasing over the years. We're more comfortable culturing now at pH levels below 7.30 than we used to be. When I grew up in IVF, we were culturing around 7.4. That was our target pH. And we've certainly varied from that, especially in the first culture interval. So I'd like to close with a controversial question. We spend most of our days, being obsessive and compulsive about maintaining our optimal conditions for our lab, static conditions, 37.0 or 37.2 degrees, CO2 at exactly one number, temperature at exactly one number. And none of us who have gray hairs grew up in that kind of condition in vivo. And I just wonder, for the future, question for the future, how optimal are the static conditions that we're striving to create in our lab for optimizing embryo culture? So I'm going to end with that, and I'm looking forward to entertaining questions when we get there. So thanks for your attention.